Hello, we are the Knowles Insurance Agency, husband and wife team, Richard and Samantha Knowles. We've had the great privilege of serving Medicare beneficiaries for over 16 years. Congratulations, you are Medicare eligible. Now what? Let's talk first about your Medicare card. It represents original Medicare Parts A and B and has no network. You can go to any doctor, any hospital without any referrals with original Medicare. Let's go ahead and look at an actual red, white, and blue Medicare card. Here is a sample card. Your card is clearly going to have your name, your Medicare claim number, your gender. It will have the hospitalization Part A, your effective date, the medical Part B, and your effective date. So what exactly does Part A and B cover? Let's get into that. Part A, hospital insurance. Let's look at the second column. That is what the beneficiary would have to pay out of your pocket. So there's a hospital deductible, $1,364. That's per benefit period. For a single hospital confinement, if you were in past 60 days, you would pay $341 a day for days 61 through 90. If you were in the hospital past 90 days, you would pay $682 a day for days 91 through 150. The first 20 days of skilled nursing is covered under the Part A, but if you're in past 20 days, you pay $170.50 for any days, between 21 and 100. Now, normally people get a zero premium Part A. That's because they've worked 10 years or 40 working credits in the United States or their spouse has. If you've worked less than the 40 quarters, you'll see the breakdown. You still can purchase Part A. Part B, medical insurance. There is an annual deductible of $185. There is a monthly premium for Part B of $135.50. If you're a higher income earner, you could have to pay additional premiums. It's called IRMA, but the majority of people pay $135.50. Then Part B covers 80%. You have 20% out of your pocket, and that's for all doctor services, x-rays, labs, chemotherapy, radiation, surgeries. 20% of the bill comes out of your pocket with no out-of-pocket maximum. There's no limit on what comes out of your pocket for your Part B. So people choose to limit their out-of-pocket costs by either enrolling into a Medicare supplement, also called Medigap, or a Medicare Advantage plan. Let's talk about a Medigap first. All Medigap plans supplement original Medicare. What that means is they offer the exact same nationwide coverage as Medicare. Medicare pays first, and the supplement would pay second. The Medigap is a health insurance policy. It's sold by private insurance companies, and they offer different sets of benefits. They are lettered plans. I'm going to show you a chart from the Medicare and You book here in just a second. But for example, one plan might cover the co-pays and the deductibles. Another plan might cover the co-insurance, and yet a third might cover all the co-pays, deductibles, and the insurance. So let's look at the chart. So let's look at a Medigap chart. This is in your Medicare and You book. And you can see the letters across the top, and you see the percentages that designate what parts of A and B they fill in. It's always a good idea to talk to an agent just to kind of understand all this. But for example, let's look at a plan G. And basically, you look at the 100%. The G says, I'll cover all the hospital co-insurance and costs. It says, I'll cover 100% of the Part B co-insurance. Just keep scrolling down. You'll see 100%, 100%, 100%. Now, it does not fill in the Part B deductible, but that's that $185 calendar year deductible. Other than that, the Plan G covers everything once you meet that 185. It also covers foreign travel. You'll notice at the bottom the C, D, F, G, M, and N, they all cover a benefit called foreign travel. So if you travel outside the country, they'll cover up to $50,000 for a foreign travel benefit. That's another great thing about the Medigap plans. Now, the average monthly premium for a Medigap plan, and it differs different states, but for a 65-year-old individual, the average premium is anywhere from $100 to $200 a month for a Medigap. That's in addition to your Part B. It does not replace your Part B. It's in addition to your Part B of $135.50. Also, the Medigap plans do not have a drug plan built in, so you will need to go buy your own standalone drug plan if you want one. Part C, Medicare Advantage plans. These are smaller local plans with networks of providers. A network might include a bunch of counties or an entire state. These plans are also offered by private insurance companies, and they offer the exact same services that original Medicare covers, but they usually add a few extra benefits like dental, vision, wellness, and most include a drug plan. Now, when you join a Part C Medicare Advantage plan, you are no longer with original Medicare. You no longer have the nationwide flexibility. When you enroll into a Medicare Advantage, you're agreeing to use their network of providers and get referrals if the plan requires it. In return, you pay a low or zero monthly premium, and you only pay copays when you use the plan. So on a Medicare Advantage plan, you pay as you go. Now, a very low or zero premium and pay as you go, it sounds really good if you remain pretty healthy. I always like to point out that if you're on a Medicare Advantage and you start having chronic conditions, heart conditions, even cancer, and you're always paying a copay for this, copays for tests, co-insurance for treatment, those could actually add up pretty quickly. So, Medigap plans give you the flexibility to see anyone and you guide your own care, but you pay a premium for that, and they don't have drug coverage built in, versus a Medicare Advantage plan with a low or zero monthly premium, and you simply pay as you go. Take your time in choosing your plan and reach out to us anytime. We have over 30 companies, and we will happily brainstorm with you and try to find a plan that works best for you. We are the KnowlesInsuranceAgency.net. That's our website, and I'm Samantha Knowles.